Okay, so for us, I'm gonna hook up an aerosol. Normally when you intubate somebody, normally they're going to go onto a ventilator. But we're gonna actually put them just on an aerosol T-piece. But most of the time when you intubate, you're going to actually put them on a ventilator. You won't put them just to an aerosol like I'm gonna do. Okay, so I have two, normally in most places you'll have two oxygen outlets, but we only have one oxygen outlet. So I'm pretending this one is oxygen also. So I'm going to hook one to my ambu and then one for my aerosol. I'm going to have my aerosol hooked up to this one. So always you want to make sure you're getting everything ready first. Then I'm going to hook up my suction because when I intubate him, he may need to be, I may have to suction the back of his throat to be able to see his, down his throat and see his epiglottis. So you've got to make sure you have suction already set up. Okay, so one of these tubings is going to go from my suction regulator to my suction canister. And then the other tube is going to go from my canister. And then I'm going to have, this is an oral suction or a yank hour. You see how it says yank hour? That's the, so I'm going to have this set up to suction out the back of his throat. Let me turn this over. The alarm telling me the oxygen is low, which I know that.
It's too late, I caught you.
You got it, Becky?
No, yeah. Yeah. No, it's okay, it's okay.
Okay.
Thank you.
Okay, so, all right, so I have my suction set up. I'm going to move it, it's like everything's on one side. I'm going to move my suction over this way. And this is what we're looking for. So when you go to intubate your mannequin, so look, this is the epiglottis. This is where the tube's going to go. See, it's got these little ridges on it. So you're going in here. So that's what you're looking for. So when you see that, that's where you're going to put your tube. Okay. All right, so then the other thing I'm going to get ready is one, I want to have my tube ready. I put a stylet in the tube to make sure to make it stiff, but you don't want the stylet going past the tip. See, if it's past the tip, that's too far. It could end up puncturing the trachea. So only to the tip. So therefore, you're going to bend it so it doesn't slide in. The other thing we're going to do is we're going to check, always check your pilot balloon to make sure there's no leaks. Even though you just opened the package, make sure there's no leaks in it. Okay? So I have this ready.
Now, I understand why we're doing that. Why are we inflating the balloon at the end?
To get a seal. So that the tube seals the trachea. So when I push air in through the tube, it goes into the lungs and it doesn't escape up around the tube. Okay, so I have my tube ready. The next thing is I'm going to use my laryngoscope. I have two blades. I have a Macintosh blade and a Miller blade. So the Miller blade is the straight blade and the Macintosh is the curve. So it's up to you which one you prefer. You can try them both. But once you hook it on, so you're going to hook your blade on, and you want to make sure that your light's on. If your light's not on, it could be that the bulb is burnt out, or make sure that the bulb is actually screwed in. And it also has batteries in here. Okay, so I have my blade ready. I have my tube ready. I have my ambu. I have my ambu set up. And I'm going to turn it up to 15. Okay, so I have my ambu ready and I have it on. And then one more thing is I'm going to need to make tape. So I'm using this cloth tape. Now how do you make tape? So I'm going to make enough tape. Actually, let me get you scissors. So the tape, you want to make sure that it's actually long enough. You want to make sure that it's actually long enough to go across the face. Some people will do it this way. They'll take the non-sticky side and put it around their head to make sure. Don't do it with the sticky side because then you'll pull out a clump of hair. Let me grab a scissor and one more thing. Okay, and also I have this attached. So this is a T piece, so I can attach this to my ET tube. Okay, so I'm going to cut my tape. I want to make sure that the piece that's attached to the back of the neck doesn't stick to his neck. So I want it to stick to his face, but not to his neck in the back. So I'm putting one piece, so this part will be around his neck. And then I'm going to tab each end of it. What it means, and I'm just cutting it so it'll split. Tabbing means that when the next person goes to untape this tube, they'll be able to find the end of the tape. So it won't be difficult. I'm putting tongue depressor so the tape doesn't get all twisted and stick to itself. Okay, so my tape is ready to go. My suction is on, my ambu is on. I'll turn this on once I'm ready. So this aerosol, it really depends on what I want. Let's say I'm putting it on 40% oxygen. Okay, so I have everything ready. My tube. Okay, so I'm first going to, normally you won't drop it on me. So I'm first going to ambu my patient. I'm going to put him in sniffing position using the CE method. And I'm going to give him some breaths. I want to see some good chest rise. So I'm hyperventilating for 30 seconds, 29, 30. Those are quick 30 seconds. So once I've intubated him, then when you hold your laryngoscope, no matter whether you're right-handed or left-hand, laryngoscope always goes in the left. You always have to hold it in the left. You're going to put this into his mouth, and you want to be able to see down, and the tube does not slide into the laryngoscope. It goes around. So you want to put this in. You don't put it all the way in like this. For the Miller blade, you're going to put it in, you're going to have this much of it out. Okay, for the Macintosh will actually position like this. Like this. So it's actually holding the epiglottis open. Whereas the Miller doesn't actually hold it open. Okay, so again, I hyperventilated. I'm going to put the blade in. Okay, and I want to see if I can position it so I can see the epiglottis pretty good. Okay, then I take my tube and I slide it in. Okay, then I take my laryngoscope out and not have it hooked. Take out my stylet, inflate my cuff, and now I need to see if I'm in the trachea. So the way I'm going to see if I'm in the trachea, I'm going to use my end-tidal CO2 detector. And I'm going to ambu my patient. One, I want to see bilateral chest rise. I'm looking for a color change. So normally this would start purple. When it changes to yellow, I'm in the trachea. And then the third thing is I'm going to listen to breath sounds. And I'll have a stethoscope. You're going to listen over the right lung, left lung, and stomach. Okay, so once you've confirmed tube placement, now I'm going to just hook him up to oxygen. Or you would hook him up to a ventilator. So I've got him hooked up to oxygen. Now I can tape my tube. So taping my tube, I'm going to put it around his neck. Okay. I'm going to split the tape. Okay, and one side is going to go anchored over his lip to hold it there. Then I'm going to go to the next side. Move this over a little bit. Okay, and then I'm going to go to the next side and I'm going to split it. This is going to go over the top of his lip. Over the top of his lip, and it's going to go around his tube. And I'm at the 24 at the lip mark. So it goes around the tube. Okay. Then this side is going to go again over the top and around the tube. Okay, so I have the tube secured, and then this one is just going to go over just to keep it secured. I'm only testing him because he's a mannequin. I wouldn't do that to real people. Okay, so his tube is secured. So he's on his oxygen. So that's what you're going to do. So you're going to go through all of the steps. First, you set up everything. So you want to set up your oxygen, your suction. If I was intubating him,
yeah, that's what I was going to say.
If I was intubating him and I couldn't see my cords, because he's a mannequin, he doesn't have any saliva, but I may have needed to see, oh wait, I can't see, he's got a lot of saliva. I'd suction the back of the throat so I could visualize. So suctioning is as needed.
And it's when you attach it, that's when you turn on the oxygen or before?
Yeah. You turn it on before. I'm not turning it on because it's low, but normally you turn it on before.
So you ambued him to get him hyperventilated?
Hyperoxygenated.
Because there was going to be a period there where he was not going to receive oxygen.
Exactly. So I'm going to hyperoxygenate him. Then, you know, and then if I couldn't get it in right away, I would stop, give him some more breaths, and try again.
And then that balloon is inflated, so he's only getting oxygen from here.
Yeah. So that when we go to push air into his stomach, it doesn't escape around the tube because the cup is inflated. So it goes in, inflates the lungs, and comes back out the tube.
He's able to exhale CO2 through his nose, correct?
No. Everything has to come through the tube because of the balloon. Because remember, the balloon is probably right, you know, in this area, inflated.
So the carbon dioxide is coming out through that end.
Yeah, because this is the way the flow is going.
Okay.
Okay. So you're ready? So all three stations, there's three that have the exact same thing.